Hi, sir. Good day. We are very glad to have you. I'm gonna make you co-host now. I'm sorry for the 5-minute delay that we have.
No
Uh,
worry. Good day to everyone, and good day especially to my old friend Kazem. I was very happy to follow his dissertation on a very important topic, and with the hope for the future and future activities. Can you hear me well?
yes, your voice is very clear.
Okay. Now I'm going to share the presentation. I hope you can see it right now.
Yes, we have it.
Okay, if you are ready, I'm ready.
Yes, go on, start whenever you want.
Okay, look, what I'm going to present is the issue of old age suicide and its peculiarities that may teach quite a lot on what could be the essence of suicide, but also the many facets of suicide and the many differences also existing in different cultures. I have no, just a second, that is not turning. Okay, no disclosure of any kind. This is the outline of my presentation. I'll go briefly in showing what is happening to suicide in old age, the areas of risks, the challenges that many older adults face in their life, and their possible reasons for suicide, and our possible ways of understanding suicidal behavior and what we can do for them at the end. So, as you can see, this is from the Global Burden of Disease study, but you can see that in the different areas of the WHO regions, the highest rates are always in old age. So, ubiquitously, suicide in old age is the most relevant one. This is a bit dated a few years ago, but it shows something quite important and quite unexpected, that the rates of old age and suicide globally are the ones that have declined the most. So suicide is all over declining, and certainly this is very good news. The reasons are unclear. But with regard to old age, possibly, globally speaking, the better assistance, the better access to health assistance, the improved quality of life in many countries, and the instauration of pensioner programs probably have made a big role, have played a big role. And this is again WHO showing that suicide, apart that in Americas, suicide has been declining in both sexes all over the world. So it's quite disappointing that, particularly in males in the Americas, suicide have been increasing. Americas is still the richest country. America is still the country where there are more dollars than everywhere else in research. And even if our American colleagues are complaining because suicide is the Cinderella of the research grants, still the money put in suicide is uncomparable with the one put in other countries. So this is particularly disappointing, but also interesting because it means that there are other factors that are counteracting any good intention in this regard. And this is the CDC, the Americans, that are pointing out the problem of suicide in old age among the Americans. And I would like to draw your attention, particularly for the very old individuals, and particularly for the huge difference between males and females. If you consider the group 75-84 in the green column here, the difference is clearly 7 times higher in men compared to women. But if you consider the older and the oldest in this graph, the 85 plus, the difference is 18 times higher, which is enormous. So you cannot imagine that there is a distribution of mental health disorder so comparable among sexes. And so there are other factors clearly that need to be controlled for. The CDC complains that the American population, with regard to the 65 plus, comprises 16.8% of the entire population, but makes 22% of suicide. Italy is much worse. Italy has 24%, is much older as a population. 24% of the general population made up by 65 plus, but the contribution to suicide is enormous in old age, is the 37% of all suicide. And
Excuse me. Okay, I'm sorry we lost your voice.
I beg your pardon?
Okay, we have you. We have
Okay,
you. Come on. Sorry.
okay. Can you hear me?
Yes, it's okay.
Okay. This is Australia, my other country. And you can see that also in Australia, there are peaks in old age, even if there is the typical bimodal curve in suicide from the epidemiological point of view. Suicide continues to be, even in centenarians, in the very old people, attributable much more to men than females. And why women are so good in counteracting suicide? Well, women are better, much better than men in adapting to daily life and daily contingencies. They have a much better preservation of social networks. They are very self sufficient in daily activities, even if they are in a very advanced age. And they continue to be mothers even if they are very old. They have children, grandchildren, grandchildren, and in every case, they are taking care, attention to their children. And in addition, their help seeking is unmatchable to the one of men. So they know where to go, they know how to ask, they are willing to be helped, contrarily to men. And in fact, men are still imprisoned in roles of masculinity that makes them just the providers and those who apparently, I'm underlining this, are making decisions. But clearly, it's a sign of vulnerability that becomes incredibly evident in extreme old age. So, in old age, men are particularly suffering. But let me tell you what I have been pinpointing many years ago and what I have controlled just recently. So even in countries belonging to the same Western traditions, the differences from a cultural point of view are very important. This was a study published in Crisis in 99, in which I took Anglo-Saxon countries against um, Mediterranean, Latin origin countries. And you could see from here that Anglo-Saxon countries in young individuals are very high in rates, and on the contrary, Latin people are very low. But with the growing age, there is a crossing over of these two trends, particularly when people age at 65 plus. And then the Latin people become much more vulnerable to suicide, nearly double what their Anglo-Saxon peers present in terms of rates. These are males, but the same happens in in females, even if the numbers are much lower. So since it appeared to me like a cultural embedded pattern of behavior, I wanted just recently to control, after so many years of globalization and everything that happened in these 3 decades. And recently I went to check if the situation was still the same. And in fact, it was the same. The Latin are continuing to be very low in young age, and the Anglos continue to be very high in young age. But the contrary happens when they get old. And these are males and females are pretty the same. There is some slight difference in the sense that, for example, some countries have improved more than other countries in assistance. This is the case of Spain, for example. So, particularly new pensioner programs and more money available to old age individuals have pushed probably for some improvement. But what is implied in these observations is that there are cultural patterns that are to be kept in mind when we study suicide and possible remedies to suicide. So we need to tailor programs. So we have also to consider the underestimation, and we are to consider also new phenomena that are particularly evident in Western hospitals, but I'm sure not limited to Western hospitals, because many people are indeed suicidal if they are convinced or they are on a terminal condition basis. So voluntary stopping eating and drinking needs to be considered as a real form of suicide. And you are aware there are states in which there is euthanasia and medically assisted suicide. Now, in 5 states of Australia, for example, 5 states have medically assisted dying in hospital considered. So things are changing also from this point of view. Now let's enter the dimension of the areas of risk. And as you know very well, in old age there is greater determination. People are much better in disguise in their intention. They choose more lethal methods. They are paying particular attention that nobody may intervene. And clearly there is much evidence of physical condition, particularly chronic condition accumulating that render the life of individuals very difficult. And there are much fewer diagnoses in psychiatric terms. So the proportion of old age individual with the psychiatric condition is much lower than individuals which are younger. This is the Australian Institute for Suicide Research and Prevention, and this is the beautiful Queensland Suicide Register. You can see from here that psychiatric diagnoses in the 65 to 74 are probably 42%, but this percentage decreases and virtually halves when they are 85 plus. But the physical condition that is already present in the 65 plus grows proportionately, covering nearly all individuals who died by suicide. And there are sensory disorders, the cardiovascular disorders, and impediment. And this is shown in columns for what concerns the presence of mental disorder as recorded in the Queensland Suicide Register, the same paper. It's less than 40% what concerns unipolar depression. And the other one is anxiety disorder and cases of dementia in these individuals. Remember, please, this is WHO, this is not my opinion, that disorders in the affective area, so depressions, are declining with the advancing age, and they are much higher in females at any age, females that die much less by suicide than men. So this is the paradox of suicidal behavior among sexes. And men who are always less depressed or show sign of depression much less frequently than females are those, as you have seen, that died much more frequently than females. And this is a beautiful a graph from Sheena Faisal and Bo Runeson, published in the New England Journal of Medicine. And they have done something quite rare in suicidology literature. They could indicate that in older adults, the impact of psychiatric disorder is much less than in other ages of life, including severe mental illnesses. But social support is incredibly important. Life events are incredibly important. Access to lethal means is very important. Of course, genetic factors are not changing through the course of life. Look, anxiety can become untreatable or poorly treated. And you know that cortisol peaks early in the morning is the hormone that makes our waking up. And so anxiety is also something accompanying this moment. And this was the hospital, the geriatric hospital of Padua, which was a large hospital. And it shows quite a number of cases that suicided within the hospitals. And they choose to die uh, early in the morning. In nearly all cases, there was a strong untreatable, apparently, anxiety, and there was a change of turns in the personnel, so less probably observation, and many of them just fell off from windows of the hospital through anxiety. You have seen in the Queensland Suicide Register that there are a few cases of dementia, and clearly the impact changes with the age. Don't forget that dementia is more frequent in women than men. But in any case, in educated person, the early stages of dementia, clearly there is more suicide than in severe stages of dementia. If you consider severe stages of dementia, you are in troubles because probably people are not able to speak in a clear-cut way, and the cognitive deficit are so important that interpreting intentions of people becomes nearly impossible and very, very difficult. So we have to keep in mind that receiving a diagnosis of dementia needs to be attentively scrutinized because it's a very delicate moment. And as you know, there are no therapies for dementia, so many people can be aware of what could be the evolution of dementia and deciding to cut short their life. Physical conditions are or could be very painful, but also not only the pain, but also the fear of losing control in your life. as in case of a diagnosis of blindness, for example, or in case of a diagnosis of cancer. The initial months after the diagnosis, and especially after the conviction from the individual that cancer is incurable, are particularly difficult for people. And suicide is more frequent in these stages. And then there are plenty of psychosocial factors. Retirement, especially if involuntary, poverty, food insecurity, moving or being forced to move to a nursing home or to another location, and then becoming a widow or a widowed person. So losing the spouse of a life, a partner of a life, your emotional reservoir, especially for a man, and being unable to make another meaningful project in life. But also losing pets can be very important. Having big family discord, big family conflicts, and having a piling of losses in your life, it's very difficult and very dangerous for individuals. So there are quite a number of conditions that can be particularly impactful on men, less adaptable to changes and less apt to governing themselves in daily life. Their level of self-hygiene or hygiene of the house, preparation of food, washing, keeping clear the environment, all this stuff are not habitual for many men in the world. Possibly the future generation will be much different from the old age people of today's, and we clearly hope in this sense. But at this point in time, this is the situation for old age individuals. Is there any impact of media that could be as dangerous as they are for vulnerable individuals and youngsters individuals? Well, we have no clear proof that the old age are equally sensitive to glamorized news of suicide through the media or things of this kind. I would say that the experience of life, becoming experts of own behavior and reactions, clearly gives a protection to individuals. On the other hand, much more dangerous is the provision of lethal means and their capability of accumulating pills, for example, accumulating barbiturates for people who suffer from epilepsy can be particularly dangerous, and also putting together drugs, psychotropic drugs, and adding alcohol can be clearly dangerous, or living in high-rise buildings and attending at places where suicide was iconic, like the Golden Gate or the Story Bridge in Brisbane. So there are conditions that may favor the lethality of suicide in old age. And we don't have to forget that early life experiences are also important for suicide in old age. Being neglected, being abused, living in a violent environment was always pretty neglected by the literature on suicide, but it's important even in old age. And what are the main challenges to individuals that maybe, in the majority of cases, they live with a sense of plenitude and well-being that is better than in other ages. But unfortunately, losing independence, social roles, social connections, particularly for men, being affected by some physical condition, and so being concerns or less autonomous, less mobile than before, are also very important. And in addition, there is this bad danger of egoistic attitudes of people. So you are old, and particularly in Western countries, you have no value anymore, and so there is no respect. There is a discrimination based on your frailty, your vulnerability, and these may favor, in a frequent number of cases, isolation and loneliness. And WHO finally discovered the danger of ageism and made a report 4 years ago, and noticing that not only there is discrimination and patronizing, elder speaking. Did you understand, boss? This way of speaking, which is minimizing, ridiculing old age individuals, is terrible, because we are humiliating them. And what is even worse is that people internalize that ageistic perspective, and they start thinking that they are not good at anything anymore. So they are unable to learn a new language, to have a new hobby, to take any new initiative, because they are too old. This is self-directed ageism, which is terrible, but it's very frequent. And ageism kills individuals and reduces their lifespan. And there is an international group, I honor to belong to this group, that is trying to change also the stigma embedded with ageistic approaches. For example, stopping to call them the elderly, but just choosing to call them the older adults. But unfortunately, ageism starts in antiquity. Terentius Afro called senectus ipsa est morbus, which means that old age in itself is a disease. And look at what said Jose Bergamin, a very famous Spaniard, a poet from Spain. At 60, we can commit suicide. At 70 is advisable, but at 80 is obligatory. This is terrible. It is the epitome of ageistic approaches. And clearly, ageism is also counteracting suicide prevention, as I stated in this issue of psychiatry. Isolation, loneliness, the worst type of poverty, said Mother Teresa. And also the Surgeon General of the United States, he noticed that we are well connected today, better than every time before. But loneliness is continuing to increase despite this virtual connection and this possibility that we have. And loneliness is killing people. Loneliness, that quality sensation, is bringing individuals to a miserable condition of isolation in which really you lose your possibilities of expressing yourself, of being known by other people, and letting them know that you are a particular person, having not that quality of relationship that you needed. And this is a research that was using the share data set, and it was a controlled study between suicided older adult and people who died by accident. And we discovered that the most relevant variables in explaining the variance was, in fact, social connectedness, the frequency of contact with the next of kin, and the duration of your physical condition, and the number of your offspring still alive. And one in Australia made an investigation, an interesting investigation. I'm closing to conclude. Why people are dying by suicide. She interviewed a number of old adults who survived to their suicide attempt, and they say, "Look, enough is enough. I felt very lonely. I felt just a burden. I had too many adversities accumulating. I see no future for myself. I think that I was rejected and the situation was untenable." So, as stated in this paper, suicide prevention is something much beyond psychiatry. So don't reduce that to psychiatric intervention. There are many possibilities, and I saw already Kazem Malakouti talking about the possibility for the future. And clearly, it's important that we raise the awareness, that we help people in any way. Crisis line are important. We had telecheck, telehelp in Italy that is still going on and saved many lives. But we have opportunities of any type. Mm, I'm not sure that drugs by themselves can rescue anyone. You have to add psychotherapy, and especially you have to add your sense of humanity to people and creating an interaction that needs to be very empathetic. If the patient or the person doesn't feel the empathy, the chances of rescuing this person are really minimum. I thank you for your attention. It has been a pleasure to be with you, and I'm ready to answer any possible questions.
Thank you very much. This was a very powerful and detailed talk. We are about 9 minutes over the time slot, so maybe we will skip the question and answer. And if you allow us, we can share your email with the participants and they can later reach out.
Sure.
Okay, thank you very much. Our next talk is on antidepressants and their effects. فاطمه جان سلام. صدای منو داری؟
سلام عزیزم. بله صداتون رو دارم، فقط ویدیوم متصل نمیشه.
Thank you, Niki.
یه چند لحظه.
Bye to all.
Thank you for being here. It was an honor.
Thank you.
Thank you so much, Dr. Delo, Professor. It's a nice hearing you again.
Thank you, Kazem. Nice to see your face and to hear your voice. All the best to all of you, and long life to suicide prevention in Iran.
Oh, hopefully. Thank you so much.
Bye. Goodbye.
Bye-bye. Goodbye.